Lord Darzi, I'd like to start by thanking you on behalf of the Commonwealth Fund and the Nuffield Trust for taking part in this interview. From your perspective as a senior clinician and one that's had a unique perspective as a government minister as well, do you think our new Act is well placed to enable clinicians to actually get involved now in improving quality?
I think the aspiration of the bill is obviously to engage more clinicians, and that's a very important prerequisite in getting clinicians obviously involved. But ultimately, it all depends at the level of the frontline staff. Ultimately, if you're going to do quality improvements, it needs to be at the ward level, it needs to be at the clinic level, it needs to be in the GP practice level. To do that, you need a completely different set of dynamics. You can't get people to improve quality through legislation. If that was correct, we would have improved many, many aspects of our society. So these clinicians, people like me, need to be engaged, need to be empowered, need to understand the language and obviously see the vision where we are all heading. And we've seen examples of that throughout the years. Certainly when I was in office, high quality care for all was all about engagements of clinicians at the front line with their own customers, the patients and the taxpayer in the form of the public. We engaged 60,000 people. And that whole purpose of that engagement was to redesign pathways. And from my perspective, they had to be redesigned not on political rhetoric, they had to be redesigned based on evidence-based, because ultimately clinicians will believe in the evidence, and that is international evidence base, and they come up with their own locally designed pathways of care.
What are the key ingredients? And I'm mindful of the fact that what has changed over the last few years is the fact that now the budget for the NHS is incredibly tight. And the danger there, I suppose, is that people will become risk averse, that that process that you've just described might not take place because people are worried about just delivering the same old services in a smaller budget.
At a time of austerity, the only way in which we're going to get the NHS through this is by collaboration, by engagement, by dialogue, by disclosure, being open and transparent, what works, what doesn't work. There are some tough decisions that need to be made in relation to how much we spend and the quality we get out of the amount of money we spend. That includes looking at some of our services, whether they are viable services from a quality perspective, and then make some of these tough decisions. And ultimately, these decisions have to be local. These decisions have to be led by clinicians. These decisions have to be consulted with the local population. And I always believe that if you are to make change, the alternatives need to be very clearly demonstrated to the user of the service and to the taxpayer before you make that fundamental change. And there are numerous examples of this in which we've done it extremely successfully. Take London, for example. Back when I first started to look at London in 2006, a city that is well known globally as being one of the best capital cities in the financial sector, that's in the good days, the university sector, but in the health service we were well behind the rest of the country. And look at it now. The tremendous advances is made in stroke services and the quality of stroke services, trauma services. In my own patch in northwest London, the integrated care pathway, which has really driven tremendous quality improvements across. But all of those were made based on these four very important principles that don't happen in Whitehall. They happen locally.
But what is the role of government? Is there a role for government? Because the current government's vision is very much of trying to decentralise, to give people as much autonomy as possible, which sounds very attractive. And yet I guess the danger is that there'll be lots of little piecemeal initiatives that never get linked up.
The government's role when I was in government was an enabling role. I did not see, when I was asked to come up with the white paper that I did in 2008, High Quality Care for All, when I first started looking how I'm going to really, how I'm going to design this white paper, it was quite clear to me we've already had 4 of these in a very short period of time. So the idea that I'm going to sit down in one of these big offices in Richmond House and come up with yet another white paper, it wasn't going to work. And the only way to do that was really to start developing many of these policies from bottom up And the role of Whitehall was to come up with the enabling policies to really allow clinicians at a local level to translate aspiration into a reality. So that's one of the government's role. In certain areas there is it's a term not never really liked, is the co-production between the centre and the local, because we need to get the balance right in a system like ours, where we should be very proud to have a national health system, because being national is extremely important. We should have national standards, but at the same time have the local flexibility in translating these standards into real quality outcomes, whether that's the health or the health care provision at a local level.
One of the government's objectives, well, specifically the Secretary of State Andrew Lansley, was to set up a bill, an act in which further reorganisation or political interference would never happen again. Are you confident that he's succeeded in setting that up?
Time will tell, and I think, it all depends what you mean by political interference. There's a group who looks at political interference in the sense that they are directing the change at a local level. But I think on the other hand, we do need political leadership, so I don't completely believe you can wash your hands of this. We have a tax-funded system. Whether we like it or not, a tax-funded system, the accountability goes to a democratic government which has been elected on behalf of the taxpayer. So you cannot dissociate yourself from it. And I think what we need when it comes to political leadership is some of the changes that are required that historically politicians shied away from making, like service reconfigurations. And I think we need to get the balance right, and I've said this in Parliament at the time when the bill was going through, a very clear balance between what I call the politics of saving lives versus the politics of saving votes. We need to manage that conflict as well. So there are two ends to this spectrum, the role of government or political involvement in health system reform.
Lord Darzi, thank you very much for talking to us.